My whole life has been devoted to helping people recover from severe illness, catastrophes and trauma. My colleagues used to say, why do you want to go into that field? It must be so depressing to have to deal with people after a stroke or after a spinal cord injury. Well, what I found in my work is exactly the opposite. It's so wonderful to see how resilient the human spirit is, and how in the face of terrible, overwhelming adversity, catastrophe, people can see a light, they can still have gratification, there's still a life to live. We're able to actually change people's lives for the better, even though people are faced with a permanent disability. And that's very rewarding. I was born in Australia and went to medical school in Melbourne. After graduation from medical school, I came to the United States to the Mayo Clinic, very interested in the recovery of neurologically impaired people, and so I took a PhD in neurophysiology to give me more background in that. And I worked in Canada then, after that, for a few years. I was head of a rehab program there, did some interesting things in the community, started a horse riding program for some of my patients who had been through our center but needed more activity in the community. But then I was recruited to come to Loma Linda to develop, actually, from the ground, a rehabilitation program. In 2004, we moved our adult rehab from the main hospital down to the East Campus in remodeled space. We lost our pediatric rehab. And so there was no resource in the Loma Linda area for treating children who needed intensive rehabilitation. Right at that time, I recognized that Totally Kids was in the process of expanding. They decided to turn that rehabilitation service into a pediatric rehabilitation program. And so they contacted me, and I was very happy to work with them because I saw there was a big need in our committee. I was really disappointed seeing children that needed rehabilitation having to go off to Los Angeles. Great difficulty for families to stay connected with their children. I wanted those children to be able to have treatment right here in this area. So we are fulfilling a big need in the community, and I think fulfilling it well. What's very interesting to me is that years later, I will sometimes meet some of my patients. They will quote back to me the exact words that I would have said to them when they are at the bottom of their situation, don't know where to go, but they are listening. I'm very impressed at how receptive people are to just simple encouragement, setting some goals, setting up targets for people, and for suggestions on where they should go and what they should do. Many people my age have already retired, but somehow I flunked retirement. I've cut back my hours, but I'm still actually seeing patients on the ward. My colleagues say they need me and they want me there. And we're still doing some research projects together, so that's what keeps me going. I feel that I have a wonderful job in that I am able to be in a position, along with the nurses and therapists, psychologists that I work with, we are able to have a major intervention in the lives of these people to turn them around so that they can have a new sense of meaning in their lives again.